Our patient is a gym coach referred for the clinic for rehab management and treatment, secondary to left piriformis syndrome. Patient complains of localized pain on the left buttock rated 5 or 10 during prolonged sitting. Sometimes the pain radiates down to the patient's posterior thigh area, especially when lifting heavy weights. So piriformis syndrome is where the sciatic nerve is impinged by the piriformis muscle and causes radiating pain on the posterior thigh. Hello to each and everyone. So our case is the left piriformis syndrome. First of all, you have to introduce yourself to the patient and ask for consent. And then we are going to be taking the vital signs, the ROM, and the MMT. And then we're going to be testing for sensory of the left buttock and compare it to the unaffected side. For our special tests, we're going to be utilizing the FAIR test in the piriformis test. Our three main goals is to maintain and to restore our MMT and our RM, as well as we are going to be trying to decrease the pain on the affected area. So first, we're going to be addressing the pain. So for the pain, we have here the first one. We're going to be doing a ARM exercises towards left hip abduction, adduction, IR, ER, flexion, and extension. This is for pain relief. We could also use this and tell the patient to mobilize at home as it could give pain relief. Okay. Okay. Educate the patient to lay on the belly as he or she will be performing extension arm. Next is we're gonna be using muscle setting exercises. So these are exercises that the patient will go against your resistance, but this is not enough to strengthen the muscle. We're just gonna be using this for pain relief as this aids in the blood circulation. This could also be used as a warm-up. We are gonna be doing this in all the planes of actions of the hip joint. So you're gonna be asking the patient to contract against your resistance. Okay, so next. Next is we are gonna be doing our exercises. So trace the piriformis muscle and then apply an effleurage, and then you're gonna be tracing the muscle belly. Always take precaution when you are doing this as it could aggravate the pain. If so, stop the massage. Next is our strengthening exercises. So standing abduction, and as the patient will progress, she or he could use weights or resistance bands. If not, if a patient having difficulty, she could use any type of support. Here we will be using standing leg lifts with trunk support. So let's assume that there's a resistance band. Also here, quadruped leg lifts. And then standing extension on single leg stance on both legs. So for progression, you could always add weight via resistance band or ankle weights. Here, climb exercises on side lying. So all of the exercises are to aid with the strengthening of the IR, ER, hip extension, and to maintain all of the actions of the hip. So we also have here wall slides, and we're going to be assuming the exercise ball at the back for progression, and then single leg deadlifts. Okay. So always ask the patient if he or she is having difficulty. At least she or he should have Next are stretching exercises. Here we have prone press up on prone position. These are to maintain the actions of the hip and to increase the ER. So we have here our figure 4 stretch, one of and then the sciatic nerve stretch to increase the tissue mobility and neural extensibility. So for progression, you could always adjust the overlapping leg. And then modified fencer stretch. This is for the hip extensors. Okay. Next is we're going to be doing dynamic stretching towards hip ER, but also the patient could do other movements if she wants to progress. For patient education, educate the patient about the onset of the Piriformis Syndrome and how to avoid activities that exacerbate the condition. Next, ask the patient to exercise regularly but always stretch first. And also, ask the patient to maintain a good posture. Educate the patient that when he or she is sitting, driving, or standing, to maintain a good posture. And when lifting, do not bend over. Lift an object by bending your knees and squatting to pick up the object. And then, avoid sitting or lying down for long periods of time in a position that puts too much pressure on your buttocks. Also, while it's sitting is one of the things that could cause Piriformis Syndrome. Here, the patient can do also aerobic exercises for an overall cardiopulmonary health. And then, the patient for home exercise program. For the home exercise program, the patient could do everything that we have told her during the treatment session at home. But here is also the patient could do recommendations these following home exercises.